This is Emma. Right now, a small blood clot is being formed in the femoral vein of her left thigh. It may look small now, but it is a time bomb waiting to explode. Over the next couple of days, the clot grew in size, and her leg became painful and swollen. This is a classic deep vein thrombosis, or DVT. She should have gone to the hospital at this moment, but instead she decided to wait and see for one more day. Unfortunately, that one extra day changed her fate. All of a sudden, a big part of the thrombus dislodged from the vein and entered the bloodstream. A floating blood clot is called an embolus. While Emma was sleeping, the embolus traveled through the blood and reached the right side of the heart. Then, the right ventricle ejected it to the pulmonary artery. The main embolus traveled to the junction where the pulmonary artery divides into right and left branches. Some small emboli went even further and deposited in smaller arteries of the pulmonary circulation. Now, the deep vein thrombus has successfully become a massive pulmonary embolism. When the pulmonary artery is obstructed, the right side of the heart has to work hard to pump blood against the resistance. In severe cases, this can lead to a syndrome called obstructive shock, which is characterized by low blood pressure. Meanwhile, Emma woke up covered in sweat. She had developed severe shortness of breath and sharp chest pains that exacerbated with each breath. At that moment, she knew she was in danger. But is it too late? The thrombus in the leg has started to grow again. It's only a matter of time before it dislodges another embolus. When she was brought to the emergency unit, her blood oxygen saturation was only 88%. She was given oxygen through a face mask. Her blood pressure was 86/60, which was on the low side. After giving a fluid bolus, the doctors started a low dose of norepinephrine infusion to maintain the blood pressure. The doctors straight away suspected a pulmonary embolism. Can you guess why? Sudden onset shortness of breath in a patient with a swollen leg is a telltale sign of a pulmonary embolism resulting from a DVT. The ECG showed sinus tachycardia. Though it is nonspecific, it helped to rule out major cardiac issues. A bedside echocardiogram study demonstrated an overloaded right ventricle, which raised the suspicion of a massive pulmonary embolism. An urgent ultrasound scan of the legs was arranged. The radiologist was able to visualize the DVT of the femoral vein. But the best investigation to confirm pulmonary embolism is CT pulmonary angiogram, or CTPA. Given the condition of the patient, do you think she is stable enough to send for a CTPA? Well, the doctors have already stabilized her blood pressure and oxygen saturation. They also started an infusion of IV heparin, a blood thinner to prevent a second embolus. They decided a CTPA would be helpful before starting the treatments. This is her CTPA image. The pulmonary artery and its two branches appear white due to the contrast. The dark band-like patch is the embolus. This confirms the diagnosis of a massive pulmonary embolism. The fastest way to treat her is to dissolve the blood clot with a thrombolytic drug. It is not a safe drug by any means, since it can give rise to fatal bleeding episodes. After weighing the risks and benefits, the doctors decided to administer the thrombolytic drug alteplase to save her life. After 2 hours of alteplase infusion, her symptoms improved and she became stable. So, what caused the initial DVT? Some provoking causes of DVT and pulmonary embolism are recent surgeries, trauma, and prolonged immobilization. Blood can become hypercoagulable in conditions like pregnancy, use of oral contraceptives, and underlying cancers. However, Emma developed a blood clot due to a rare syndrome called antiphospholipid syndrome. She was discharged with warfarin, an oral anticoagulant drug. Thanks for watching. I will see you soon with another interesting medical case.